Assalamu alaikum. I am Dr. Khadiza from this Bashundhara Ad-din Medical College. Today I am going to discuss about a special sense, that is equilibrium. It is one of the part of internal ear. We know that vestibulocochlear nerve is related to the equilibrium and also hearing. So the sense of hearing or special sense is the equilibrium or a state of balance. It include utricular saccule and semicircular canals. Utricular saccule with macula for linear acceleration of the head position, and semicircular canals and ampulla with the crista ampullaris for rotational acceleration. So equilibrium also interpreted with the input from vision and stress receptors in the muscles. In this figure you can see the semicircular canals, anterior, posterior and middle, and these are the ampulla. Crista ampullaris, the dilated portion on the base of the semicircular canals, and they contain macula, and this macula and crista ampullaris are the receptors similar to organ of corti receptors. However, gravity or acceleration provide force to move stercocilia present in here. There is another figure of otolith organs of maculae. You can see the little structures on the hair cell. So any acceleration causes movement of these structures, causes acceleration of the cilia of the hair cells. So disorder in equilibrium are usually motion sickness. So it is due to sensory mismatch, sensory input mismatch. So usually drugs are used, antiemetic drugs are used for get rid of this type of motion sickness. And vestibular nystagmus is another reflex movement via input from the semicircular canals and crista ampullaris. As you rotate, eyes slowly drift in opposite direction due to backflow of the endolip. Then rapid eye movement in direction of rotation to establish new rotation fixation point continues until endolymph come to rest, then suddenly stop. Now as a whole, as we discussed from the previous lecture and also today, the summary, I am going to do the summary of hearing pathway. Hearing pathway as a whole: firstly, air column vibrate the tympanic membrane, then impulse passes through the malleus incussus stapes, then pale length of scala vestibuli, endolymph of the scala media is vibrated, motion occurs, and there is wave creation here in the fluid. Then hair cells, this wave causes movement of the hair cells of organ of corti. Hair cells of organ of corti causes depolarization of the hair cells, and then spiral gang, this causes depolarization, this causes depolarization of the neuron and causes that is transmitted to the spiral ganglion of the cochlea, that is first order neuron. From the cochlear nerve, impulse transmitted to the ventral and dorsal cochlear nucleus, that is second order neuron, and from here it goes to the posterior nucleus of the trapezoid body and posterior olivary nucleus, that is third order neuron, then goes to the lateral lemniscus, and from here goes to the inferior colliculus of the midbrain, and then goes medial geniculate body of the thalamus, that is fourth order neuron, then acoustic radiation of internal capsule, and goes to the auditory cortex of the superior temporal gyrus, that is area 41 and 42. So you can see it is a 4-ordered neural pathway, and it ends on the area, that is 41 and 42. So you can see in this figure the complete pathway. These are the pathways of auditory pathway. It shows the whole pathway, and lastly this figure shows the auditory area in the superior temporal gyrus, that is area 41 and 42, the primary and secondary auditory area or auditory association area. So from here what that most important thing you have to remember, that is the receptor for hearing is hair cell, and also the equilibrium receptor is also hair cell, and these are all these are mechanoreceptors, and the organ responsible for equilibrium is semicircular canal, and for hearing is cochlea, and the nerve is vestibulocochlear nerve, and you can see the area of hearing is area 41 and 42, that is temporal lobe, superior temporal gyrus of the temporal lobe. And the abnormalities of hearing are, you have to remember, that is deafness, and there is two types of deafness, that is a conducting type of deafness and nerve deafness. And so that's all from me today. Thank you for watching.